every time to start these medications for diabetes, like I say, they have to first screen all your body organs if they are really not affected. The reason is one is because most of the clients we get in our facilities, they come when these complications have set in, because they have been into prayers, they have been into traditional healers, maybe doing a lot of things there, and then they come when they are already in late stages of, or when their body organs have been affected. And then what we have to do is that we have to first do a checkup of every body organ of yours to see if it is really still functioning or it has been affected by diabetes. Then also we have what we call, one of the challenges is loss of quality and outcome framework in some areas. So that's what I was talking about, lacking some of these resources in the facilities, or also maybe also in government facilities where most of the diabetics are, and they are not diagnosed early enough. Then we have what we call responsibility. So in diabetes, everyone has a responsibility, especially in data collection. So you find diabetes is on increasing rate, but people are not bothered. Everyone who comes in there and then they have the diabetes, that data is not captured, so that we can really tell how we can monitor, or we can see the values, or we can take the corrections of all these people that are having diabetes, and then we know how adequately we are going to involve in. So data collection is for every individual. Let it be a nurse, let it be a doctor, let it be a specialist, so that we can see how we can curb these two chronic conditions, hypertension and diabetes. So then three is the education. Yeah. So a lot of the clients, a lot of patients, even the healthcare professionals themselves lack this primary knowledge about diabetes. So you find someone will be told that you have the diabetes, but someone won't accept, and he says, no, these are some of the things, or these are cultural things that are maybe happening in my life. So I have to first go maybe see my pastor, first go and see the traditional healer, and then later on they come when they are already in late stages of this condition. So the knowledge has to be so much intense or given to these people so that they can understand how diabetes is being is complicating the lives and causing most of the comorbidities our patients have. Yeah, so that's about the care processes and their importance or significance in the diagnosis of this diabetes and later on management of the diabetes. So, yeah, so about the complication of diabetes, like we've said, we have what we call acute complications of diabetes and then chronic complication of diabetes. So someone acutely diabetes affects you, or chronically the comorbidities you will get later on if you get this diabetes. So one of the acute complications of diabetes is what we call diabetic ketoacidosis. So the diabetic ketoacidosis is a very medical term, maybe to the layman's language, people might not understand it, is that they bring you in a hospital whereby your glucose is either very high, or it can be high but not very high, but it still has caused an effect. And one of the effects it causes, we shall find some things in urine which are not supposed to be there. You will have effects on your respiratory system. The breathing rate will not be good. They'll bring you when you're struggling to breathe, or they'll bring you when you have a lot of severe abdominal pain. So when you have severe abdominal pain, then your breathing is not okay, what we call Kussmaul's breathing. Then when you have some ketones in your urine, so you most likely have diabetic ketoacidosis. That means that sukala kususeko, and then you have started getting some of the complications that are really very severe and need urgent attention. So another acute complication of diabetes is maybe having this, someone having an MI or myocardial infarction, or having a stroke, and they bring you when you have a stroke, an acute or ischemic, acute ischemic stroke. So you find there is the blood is prevented from saturating into your brain, and by maybe a clot, or by maybe your blood vessels they have what we call some of the lipids, the cholesterol in there, and causing those breaks, then preventing blood from going into your brain, and then you end up getting a stroke. So those are some of the acute complications of diabetes, and if diagnosed early, they can be prevented. And the chronic complications, those are really so many. One is, you've heard of dialysis, you've heard of kidney transplants, and one of the leading causes of the chronic kidney disease is diabetes, what we call diabetic nephropathy. So it reaches a state, people who have suffered diabetes for over 5 to 10 years, so they end up getting such a complication. And then the kidney is not doing the filtering the way it is supposed to do, and you end up getting into dialysis, having artificial kidneys for you, or giving you another kidney. How expensive is that? Then two, losing your limbs. You can lose your leg, you can lose your hand because of diabetic wounds, because of diabetic neuropathies, because of those diabetic wounds I'm talking about. Like, the wound gets infected and it can no longer be healed. So what they have to do is to go above where the wound is, and then they chop off the leg. And we've seen these instances happen. Two is someone having what we call cardiovascular diseases. You have heart diseases because of this diabetes that is not surely controlled. And one of the leading deaths due to diabetes is cardiovascular events that happen later on with the diabetes. So, about the complications, then we have what we call in the management, how are we doing reviews for these diabetes patients? Now, the reviews can also be in two stages, especially like me, how I handle my patients. Is that the first stage of the review is data collection. So I'll do the data collection about you, maybe the family, maybe how your lifestyle, if you're smoking, if you're taking alcohol, if in your family people have diabetes. All that data is usually in the first stage of the diabetic reviews. Then the second review is about now the clinical approach. How are we going now to approach this? Because you need to get knowledge about this diabetes, that it won't heal within one day, it won't heal within maybe 1 week or 1 or 10 years, is that this is something you're going to live with. But living with it is that we are going to see how we are going to control it, so that later on in your late years, 70s, 60s and stuff, you don't get these complications we are talking about, the comorbidities, and then they affect your quality of life. But now, the problem we've had with diabetic patients or patients who have such chronic conditions is that when you tell them about that the disease is not going to heal, now they later tell you that maybe this is the other AIDS that has come in, or the HIV, and they abandon the medications because someone will not be on those drugs for all those time, and someone says, no, I'll have to complete, I'll have to finish this because me, I'm not an HIV or AIDS patient. No, it is now the quality of life you're going to live after you've started these medications, or if you leave taking these medications, because diabetes is not a one-step approach disease. It is a multi approach disease if you want to heal it. So we have to go step by step, control the sugars step by step, and also manage the complications step by step. But like I said, the primary goal is screening it early, knowing it early, and then we start medication early so that we cannot get these complications later on. So, about diabetic reviews is that when you come and then you see your patient, you've diagnosed the hypertension, and now, the diabetes, and now it is time to start the treatment. Now there is a lot of knowledge this patient has to get, this client has to get, the healthcare professional has to give you, so that you can understand the disease itself, how it came about, and how you're going to manage it or live with it. So, about the treatment, maybe that is more of the healthcare professional who is going to provide it. But there are a lot of things we consider before beginning the treatment for diabetes. And one of the things we consider is if you don't have any relevant comorbidity. You've been diagnosed with diabetes, but now when they check all other things, you don't have any other related comorbidity. There are some drugs they will give you for that diabetes. And two, you can have other complications setting in. For example, heart failure. There are some drugs they have to give you. Heart failure is when your heart starts, is not functioning the way it's supposed to function, as it is the engine pump for our blood. So you find you have diabetes, and then it has affected you, and then you get later on get heart failure. And also, we give this treatment depending on when they diagnose this diabetes. If it is early onset type 2 diabetes, there are some drugs they are supposed to be put on. Also, the obesity. Obesity, how do I mean? Is that there are some people who have diabetes but they are lean, or some have they have a bigger BMI. So there are some drugs we give you if you are heavyweight or if you're lean, because these drugs, some of the drugs will help you gain weight, or some of the drugs will be decreasing the weight as well. So we consider all those parameters: obesity, we consider if you have heart failure, we consider if you have any other relevant comorbidity, we consider if you have been smoking, we consider if you're frail, find someone is very ill with the diabetes. So there are some drugs they have to give you comparably. And I think that one we can leave it to the healthcare professional talking to their patient if they want to give them the medications. Yeah, so in conclusion, as I'm concluding, is that the very big point is on knowing what are the signs, early signs of this diabetes, and when do I have to see my doctor. So the screening, the core areas are the 8 diabetic care processes every time you go to the hospital. And every time to start these medications for diabetes, like I say, they have to first screen all your body organs if they are really not affected. The reason is, one, is because most of the clients we get in our facilities, they come when these complications have set in, because they have been into prayers, they have been into traditional healers, maybe doing a lot of things there, and then they come when they are already in late stages of, or when their body organs have been affected. And then what we have to do is that we have to first do a checkup of every body organ of yours to see if it is really still functioning or it has been affected by diabetes. So, to my clients, or to where the message is going, is that when you go to the facility and you want to know the knowledge about diabetes, or they are diagnosed diabetes with you, is that you have to be so patient, and then the doctor takes every kind of test or takes time to do a review of you, so that we can know you don't have all these complications. And two, is that when you started on medication, you have to take the medication as prescribed. For me, my patients, like at this facility, at Star Medical Center, I see almost 21 to 30 patients per month of the diabetics. So these patients are given regular reviews accordingly on how I started these medications, or according to how the complications they have. So I first begin my medications maybe today, and then I give them 2 weeks dependingly, or I give them even a month. And also the introductions of these medications or removal of these medications depending on the body mass index, or depending on how the patient is tolerating these medications. So we give them reviews maybe of 2 weeks, reviews of maybe 4 weeks, or reviews of maybe 3 weeks. So depending on the HbA1c, depending on the body mass index, or depending on how they are tolerating these drugs. And then later on, you find actually our patients are doing better if they are really adherent to these drugs and taking them well. And also, advising them on the sedentary life, avoiding smoking, avoiding alcohol intake, or reducing those styles of living. So you find that you're getting to the point with this diabetes. So I want to encourage all patients, I want to encourage all people to go and do these regular reviews. Like I've told you, we are, maybe we are born with this thing that the Africans, being an African is one of the risk factors of getting diabetes. So if you are above 35 years and you're an African, please come and check. So the checking in some facilities is free or it is at a reduced cost. So you go there and they check you. So come meet the doctor or come ask the doctor at Star Medical Center. I'm always available there. And also other doctors are always available there. And also, if you find maybe the condition is too complicated to be done, when we do also what we call timely referrals for these patients. But my patients are getting better. They are taking the drugs the way they're supposed to take them, and they are really getting better. So together, being a clinician, being a healthcare professional, a doctor or a specialist or a nurse, everyone is concerned about diabetes. So thank you so much. I think catch me in the next episode about the hypertension. But for now, for the diabetes, that's the little knowledge I can give you. For more knowledge, please consult us at Star Medical Center. We shall have everything for you. Thank you.